Well, COVID has healthcare systems in crisis mode right now.
Healthcare providers are creating protocols for treatment now that the state has activated its crisis standards of care plan. The recommendations from the state include more rapidly discharging patients, not admitting low-risk patients to the hospital, and increasing the use of telemedicine. The problem is there simply are not enough hospital beds and staff members. State epidemiologist Dr. Rachel Herlihy predicts if the rate of adults getting boosters doesn't improve, we'll have more than 2,200 people hospitalized with COVID by the first of the year, and that would be the most the state's had during the entire pandemic. CBS 4's Sean Boyd live at Denver Health. And Sean, doctors know the situation is dire.
Jim, we are not to the point of rationing care, but doctors are preparing for that possibility. A state advisory group met today to discuss a draft plan of how hospitals would decide who receives care and what level of care they get.
This is a framework that I put together in 36 hours.
Dr. Anush Mata in charge of drafting a plan no one wants to see implemented. A plan that would prioritize who gets treated at the hospital and who gets sent home. While it's still preliminary, the initial draft calls for a triage team that includes a mix of experts in medicine and ethics to make the decision. The larger question is how they would make the decision. Dr. Mata says the problem isn't a shortage of life-saving equipment, but staff.
These are different than the ventilator decisions about who's the most likely to die. This is who's the most likely to be fine without the intervention.
That may mean some people will be discharged earlier, others treated at home instead of the hospital.
And I think that concept of safe enough is critical.
Socioeconomic status could be a factor.
You can't triage to somebody to outpatient care if they don't have access to outpatient care, either because they don't have a doctor, they don't have access to a doctor, they don't have insurance.
How much care you need may also be a consideration.
Well, look, if we could save 3 people with these resources or 1 person with these resources, we should save the 3.
For now, vaccination status will not influence the decision.
Our ethical principles are to save the most lives, not to evaluate social responsibility.
The advisory group also discussed today coming up with a scoring system, algorithms that would help assist in making decisions about who receives inpatient and outpatient care. Again, the plan discussed today was preliminary, but this advisory group could vote on a final version as early as Monday. The governor would then have to activate it. Live in Denver, Sean Boyd covering Colorado First.
All right, Sean.